talk about COVID-19. Now, all 30 suspected cases of COVID-19 tested in Ghana came out negative, as according to the Ghana Health Service. So far, over 89,000 cases of the virus have been recorded, with over 3,000 deaths worldwide. Senegal and Tunisia, as you may well be aware of, have become the latest African countries recorded cases after Nigeria, Algeria, and Egypt recorded theirs. Across the globe, the World Health Organization emphasizes the need for people to pay particular attention to their personal hygiene. The Ghana Health Service has rolled out a series of campaigns to get people aware of the disease and then measures to be taken to protect yourself. Today, we take to the barbering shops and salons to speak with operators on measures they are also taking to protect themselves and other clients that they attend to daily.
I think we should keep ourselves safe about this coronavirus. For instance, our sterilizer have to be regular, and then to sometimes the comb that we use, and actually have machine spray to spray our machines, and then this is machine spray. So it's work for germs or anybody, anyone that have any effects. See, so when we spray it on the machine, it's to cure all this. So to keep our customers safe.
We've not yet gotten like a case in Ghana yet, but I heard in China like it's spreading so fast. For me in particular, when I'm coming to the barbering shop, I bring my own machine just to prevent any other thing. So I have my personal machine I bring along with me when I'm coming to barber. But I also make sure the other tools here, like they are sterilized before I allow them to use them on me.
We don't have much knowledge about coronavirus. However, as a hairdresser, I will adhere to simple hygienic practices like washing of my hands regularly to keep clients and myself safe.
Actually, I've heard that they said if someone has that infection, that person will be coughing or having a hot body temperature, something like that, but I've not seen it with my eye.
To protect myself, just that I'll be indoors, I won't come out, or maybe I'll just put a gloves in my hand or cover my mouth just to not get in touch with the virus. Since you have been watching it on television and stuff, people will be coughing and stuff, so I think maybe coughing and something like that, I think they have the virus. Sometimes if you come to the hairdresser, they just have to wear their gloves, cover their nose and stuff. But if they have the symptoms, I won't know, since I don't know the symptoms.
What I just need to wash my hands, make sure I wear gloves, and always make sure when I finish sewing and I talk to them, I need to clean myself before going inside the room or something. And I need to know how to interact with them. If maybe they are coughing or something, I just need to pull back, maybe cover my mouth with gloves or something.
Anyone who is infected, like, you should make sure you don't come in contact with them.
I really do not know anything about it. I only know that it's a disease that like is in the system. For me, I don't know what to do to protect myself or from others. I really do not know.
What we do is anytime we barber a customer, we treat the machine with a sterilizer, and sometimes we use the spray to clean it and do other things so that we can prevent diseases over here.
People are dying these days a lot concerning this very disease. But then the issue is that there is no cure for this. And so if even you go to a place like this or you come to a place like this and after barbering your hair, the machine is sterilized, you cannot still ascertain as to whether the virus has been killed or not.
I'll just have to make sure that I take my preventive measures. That is like personal hygiene, like using of sanitizers and all those stuffs. And especially since the virus is transmitted through like airborne and stuff, so we have to provide nose masks and things so that we can prevent ourselves from getting the virus.
So what must you do to protect yourself and your family? We'll bring you those details shortly. Meanwhile, the Director General of the Ghana Health Service, Dr. Patrick Abuaje, says government is procuring more PPEs to be sent to health facilities as part of the country's preparedness.
Some people feel that it won't come, and so that's the optimism. We don't hope it comes, but we have put our house in order in that if it comes, that is when we are able to pick it up. It's when it comes and you don't pick it up, then that's very dangerous. So our system is to ensure that once the person comes in with the disease, it's already picked and contained so that it does not give the opportunity to spread. So that's where we are.
If you look at the rate at which it's spread, and I know that you're in constant touch with the WHO and what the country responses need to be, it looks like Africa is said to be the low light as far as the weak link in this global chain of a health system that should be able to combat this.
Well, I mean, health systems greatly depends on infrastructure, it depends on your resources, among others. But also depends on your ability to innovate, your ability, your resilience to be able to respond to those challenges within a limited resources. And I think that is where we are. We believe that within the resources available, we have been able to mount a robust system that allows us to respond to conditions. We've faced H1N1, we had Ebola scare, it never came, but the system was ready, and this time we were able to pick up areas to actually prevent entry. And we've had others, we've been having seasonally, having meningitis, and we have responded appropriately to them.
One of the cases were recorded in Northern Africa. We're talking Algeria and Egypt. And we thought it was far off. Now it's scaled up. We have it in Nigeria. The responses of the Nigerian health authorities was that, well, because of the concerns and their preparations for Ebola and the other outbreak that had happened, they seem to have just triggered a response action. Did we have it? Do we have it?
Yes, we've had the Ebola response, and the residues are there, and we have maintained those systems because it works for nearly all outbreaks. We've always had threats of Lassa fever coming to Nigeria, Sierra Leone, etc. So those systems are there. It's a question of triggering them and strengthening them, because this is a different condition, because the rate of transmission is very high, and so we've just had to trigger the same system. And it comes to Nigeria, a person came by air, that plane could have been heading for Ghana. So it's not that Nigeria has attracted, but you don't know when someone else is coming to Ghana, and that's why it's important we maintain the systems at its utmost so that we are able to identify.
We'll certainly be getting to what you must do. What are some of the things you can do to just keep yourself safe? But like we took you through the other time, we gave you some details of the disease and how fast it is spreading, how fast it is killing people. We have an update here for you. I'll just take you through what we have here. So this is from the Johns Hopkins platform, and it totals the number of cases that have been recorded. So we're looking at total confirmed case. This is it provides live updates, and we're told when we had the Chinese guest here the other time that they get the figures from the Chinese government as well. But right now it's beyond China. This is a world health emergency. So 92,197 cases confirmed across the globe. How many people have died so far of this figure? 3,129. Have died out of this. So like we told you the other time, there seems to be a good trend here in terms of the number of recoveries, or the rate of recoveries are much higher than the rate of fatality. And so when you look at the total number of people who have recovered from this disease, you're looking at 48,100 175. That's out of the 92,197 cases that have been recorded. So I'll take you through some data we have here as well. Now, this shows you the number of countries that have recorded the cases. And if you click on it, if you go on your website, your computer, and you click on it, you will be able to click on each country and it will give you a map, gives you an idea. So we have mainland China, of course, topping the list with 80,151 cases recorded. And right after that is South Korea with 5,186. If you look at Iran, in which country we know that the Deputy Health Minister has contracted the virus himself, the Vice President of that country has contracted the virus herself, then you know that it's also a serious matter that they are number 3 on the list. That's Iran. Iran has 2,336 reported cases, confirmed cases, by the way. Italy, which has become the epicenter of the spread of this virus in Europe, is looking at a total of 2,036 cases. Now, remember this started just about last week. And at last week, we were looking at 7 by 11 a.m. on Wednesday. It had risen to 11. Now, fast forward to this week, we're looking at 2,036 infected people, confirmed cases in Italy, and several people, you know, who have moved from Italy. We know about the Nigerian case that we're told someone who traveled from Italy went to Nigeria with the disease. Now, let's look at others. And by others, they're looking at the cruise ship, for example. On board, there were several people, and we're told that it is one of the fastest spreading areas because the people were contained in in a ship. 706 people confirmed with the disease. In Japan, we're looking at 274, and Japan has cancelled quite a number of things. There is an Olympic game that's coming up this year in summer. We're not sure whether that will come up, but several other games have been called off. Now we're looking at Germany, that has a number of 165 confirmed cases. If you heard the Ghana Health Service yesterday, the case that was recorded, or the suspected case that was recorded here in Ghana, we're told that the person came into Ghana from Germany. That person has since died, but the Ghana Health Service insists that the person proved negative, or the test proved negative for that person. We have Spain, there is Singapore, there is the United States of America with 106 cases. In the United States of America, there's been a concern. Yesterday, we were told that they recorded the first death. Well, as we speak, more than 6 people, we're told, have died in the United States of America, and they are putting aside some real big amount to deal with this. There is Bahrain, there's Hong Kong, Kuwait, Thailand, Taiwan, Switzerland, the United Kingdom, as well, 2 countries where our president also has been traveling through. You've heard the concerns raised by Ras Mubarak in Parliament, asking for the president and his team to be quarantined. There is Malaysia, and there is Norway, there is Australia, there is Canada, Iraq, United Arab Emirates, and then the list goes on and on. The last count I did last week were about 50 countries. Now we know that several other countries have joined: Nigeria, Tunisia, Senegal. All these countries have joined, so we're looking at well over 50 countries here. And before I go and tell you about what you can do, just take a look at the statistics we have here. It gives you an idea of how the disease has been spreading since it started. It went all out in January 2020. We know that it started somewhere in December 2019. But between January and March, you see how it has fared. It seemed it was okay. By February, it was going up. And by the 13th of February, we seem to have recorded the highest of 15,000 cases just in February 13th. And as it goes along, it came down and it seemed to be going down. But we're in March and it seems to be coming up again. So the red is certainly the number of people who have died. And so we lost a lot more people in February 2013, and the list goes on and on. So how can you keep yourself and your family safe? Take a look at this put together by health editor Fred Smith.
Here's what you need to know about the coronavirus outbreak in China. It spreads very quickly and can be very deadly too. It is spread from animals to humans and can also spread between humans. Symptoms include fever, persistent cough, impaired breathing, running nose, skin rash, persistent vomiting, and unexplained bleeding. The Ghana Health Service and the WHO both advise people to frequently wash their hands with alcohol-based hand rub, or what we call a sanitizer, or warm water and soap. Cover your mouth and nose with a flexed elbow or tissue when sneezing or coughing. Avoid close contact with anyone who has a fever or cough. And if you touched a surface suspected to have been infected, do not touch your eyes, nose, and mouth before you wash your hands. Avoid eating raw or uncooked animal products, and seek medical help immediately if you discover any of the symptoms, and share your travel history with healthcare providers. If you do these, we will all be safe.
So that gives you an idea of what you can do, to stay safe as we pray and hope frantically that this disease doesn't come here. I'll take you to Parliament. My colleague Joseph Opoku-Gakpo has joined me in the studio. But before we go on to talk about the amendments that they're seeking to do, let's talk about coronavirus, because it's one of the things that have come up on the floor of Parliament. Joseph, you're welcome to the show. So Ras Mubarak was in Parliament today. His concern is that President Akufo-Addo has been to places like Norway, Switzerland, United Kingdom, and from the list that I went through, all these countries are listed to have had confirmed cases. Tell us Ras Mubarak's concern and how he put it across today.
He actually raised that last week, and eventually the leader of government business, Osechi Mensah-Bonsu, made fun out of it and thought that he wasn't being serious about his demands that the president be quarantined. Today he showed up on the floor wearing a white face mask. For him, he's only trying to get the education across and to draw people's attention about the need for them to be cautious and avoid doing things that would end up getting them infected to a certain extent. And he thought there's no better place to really put this out and carry the education across than on the floor of Parliament. So he came in with a mask, went around talking to other MPs and doing business on the floor with a mask on.
That's pretty dramatic. I'm wondering how people reacted to it, especially the majority leader.
Everyone was just looking at him. It really didn't come up for a conversation on the floor. People would extend, talk to him as they see him pass by and ask him about how come he had that on and all. So we saw all of that happening on the floor, but apart from the display, as you would call it, it really didn't come up for a conversation, except that sometime this week we are expecting the health minister back to respond to questions on what is being done to protect Ghanaians and to give an update on the measures that Ghana is putting in place to help avoid an outbreak.
We'll talk about the other things that were actually discussed on the floor of Parliament, but take a look at Ras Mubarak today. This is how he appeared in Parliament today with his mask on. That actually looks like a surgical mask, is it?
He didn't give us the chance to be able to interrogate what kind of.
Okay, has he tied it behind his head?
Yes,
it was tied.
Exactly, it was tied behind the head.
Yeah, that looks like the one that they use in hospital for surgery. I think there's a special mask for these outbreaks that you just stick it on to your head. And anyway, if you weren't in Parliament, we've taken you there.